Page 12. Studies on hysteria. Abreaction, however, is not the only method of dealing with the situation that is open to a normal person who has experienced a psychical trauma. A memory of such a trauma, even if it has not been abreacted, enters the great complex of associations. It comes alongside other experiences which may contradict it, and is subjected to rectification by other ideas. After an accident, for instance, the memory of the danger and the mitigated repetition of the fright becomes associated with the memory of what happened afterwards, rescue and the consciousness of present safety. Again, a person's memory of a humiliation is corrected by his putting the facts right, by considering his own worth, etc. In this way, a normal person is corrected by his is able to bring about the disappearance of the accompanying affect through the process of association. Though this we must add the general effacement of impressions, the fading of memories which we name forgetting, and which wears away those ideas in particular that are no longer effectively operative. Our observations have shown, on the other hand, that the memories which have become the determinants of hysterical phenomena persist for a long time with astonishing freshness, and with the whole of their effective coloring. We must, however, mention another remarkable fact, which we shall later be able to turn to account, namely, that these memories, unlike other memories of their past lives, are not at the patient's disposal. On the contrary, these experiences are completely absent from the patient's memory when they are in a normal psychical state, or are only present in highly summary form. Not until they have been questioned under hypnosis do these memories emerge with the undiminished vividness of a recent event. Thus, for 6 whole months, one of our patients reproduced under hypnosis with hallucinatory vividness everything that had happened that had excited her on the same day of the previous year, during an attack of acute hysteria. A diary kept by her mother without her knowledge proved the completeness of the reproduction. Another patient, partly under hypnosis and partly during spontaneous attacks, relived with hallucinatory clarity all the events of a hysterical psychosis which she had passed through 10 years earlier, and which she had, for the most part, forgotten till the moment at which it re-emerged. Moreover, certain memories of etiological importance which dated back from 15 to 25 years were found to be astonishingly intact and to possess remarkable sensory force, and when they returned, they acted with all the affective strength of new experiences.